Good morning, everyone, and welcome to our HHS virtual town hall for Thursday, October 29th. My name is Aaron Lebo. I'm the Vice President of Communications and Public Affairs. Happy to be with you today to help moderate mostly our Q&A and some of our celebrations. We have a sundry list of topics generated by some by feedback, some by what's topical, and we'll go through that. And then when it comes time for our Q&A, you can use the Q&A function, or you can raise your hand in the participants forum, and we'll call on you to ask your question live. Same goes for the celebrations, but I'll remind you when we get there. I guess to kick things off, I'll ask our President and CEO, Rob McIsaac, to give us a rundown on where we're at today and what we're going to talk about. Over to you, Rob.
Okay, thanks very much, Aaron, and good morning, everyone. And as always, thanks for tuning in to this week's town hall. I think we've got a fairly light agenda today, although that is certainly not an indication of the volume of work that's happening across the organization. I feel like we're in high gear doing a lot of things. So I guess to sum up in terms of where we are as an organization, we're kind of walking a fine line between responding to the traditional fall increased demand for hospital services, while at the same time protecting some capacity for a potential surge in COVID cases. Thankfully, we have yet to see a significant rise in the number of COVID patients who require hospital care. However, our leadership teams and a number of task forces are meeting regularly to make sure we're as prepared as possible for what may come, while at the same time avoiding the very last resort scenario of having to scale back clinical services, given all the implications and the impacts that doing that has. As always, I just want to say thanks to everyone who are enabling this work by ensuring our clinical and administrative services continue to run smoothly and efficiently. It's quite amazing the number of changes and challenges you've endured since March. They're innumerable, but your flexibility and commitment to keeping the gears in motion here at Hamilton Health Sciences are admired and appreciated, and really grateful for it. So today we're going to start off with a bit of an update on our United Way campaign, which I think is going very well. I can talk a little bit about flu shots, about testing, and then as usual, we will end with some celebrations. So I'm going to ask Lisa Webster to give us an update on the United Way campaign. Lisa, over to you.
Thanks very much, Rob. Good morning, everybody. Happy to report that our United Way campaign is going very well. We are at the halfway point of the campaign. And due to COVID-19, as most of you know, it's been kind of uniquely challenging this year to generate the outreach and the people-to-people interaction that has been so successful in the past for the campaign through the various events. So this year we had to be a little creative, creating virtual events, but I'm happy to report that they're actually going quite well. And the feedback from people who have been part of the virtual events, virtual bingo and virtual trivia, the feedback has been actually very well. So it's been good learning for us as a steering committee, and certainly the lessons learned will take into our campaign next year to create even further outreach and generate more fun to participate. Our goal, as you know, for the campaign is $100,000. And as we're halfway through the campaign, I'm happy to report we are at around $67,000 raised, which is just remarkable. And again, a lot of gratitude to all of you who have been so generous in your giving and your participation in the campaign. We do have a little ways to go. We certainly would like to reach our goal of $100,000. So we need your help now more than ever. As you know, in our community, there has been a lot of hardship faced in relation to COVID-19, and people in our communities need our help more than ever now. So please do consider donating through payroll deductions or a one-time gift participating in our virtual bingo and trivia. There's also the cookie dough fundraiser, which is fantastic actually, in terms of cost savings for those bakers around the holiday season. And our online auction as well is a really great event with some wonderful auction items that are just in time for you early Christmas shoppers. So again, I would just like to really thank everybody again for their dedication to the campaign, all the people on the steering committee, and certainly all the people across HHS who have been generous in their time spent in donations. Thank you so much, and try to continue to participate and encourage other people to give. 2 more weeks. Thank you very much.
Thanks a lot, Lisa. Great stuff. Cookie dough. Sounds good. I'm in. I am going to ask now, Bruce Squires, I think we're going to you next for an update on our flu shots around the organization. So over to you, Bruce.
Thanks very much, Aaron. Yeah, I'm pleased to act as a little bit of a, I guess, an informal champion for flu vaccines. You know, annually, influenza represents a significant cause of illness, of hospitalizations, of absences from work, and unfortunately of death right across the community. And across all of the populations that we serve here at HHS. And the truth is, much of it is preventable. We know that. So really this year, in particular, in the face of a pandemic, it's even more important and more valuable to prevent. We need to do it to keep our bed capacity available. We need to do it to ensure that as many of us as possible are able to come to work on a daily basis, and we need to do it to keep each other healthy as well as keeping our patients healthy. And again, you know, vaccines are key to that prevention. Maybe go to the next slide, please, Les. So our annual Employee Health Services Blitz, which includes extended hours, launched back on October 19th. And this year, it's already been a great success. I'm told we're 50% higher than last year in terms of the number of vaccines that have been given. And as you can see from this chart, so nearly 2,500, and we do have vaccines available for the most part. Let's go to the next slide, please. So our employee health services clinics are still running. And you can see here from 7 a.m. to 2:45, Monday to Friday. And we also have our retail pharmacies who are able to deliver the vaccine to you. EHS and pharmacy are working really hard to get supply, so don't hesitate. Don't hesitate to come get your vaccine, and we'll continue to work to secure more. And just a reminder, you know, this is at HHS is not the only place to get vaccinated. So if you do get it elsewhere, make sure you update Employee Health Services, because really we want to really understand and show that we've driven a much higher rate of vaccine coverage this year, so that we can secure that much more vaccine and supply for next year. Next slide, please, Leslie. So, you know, this is really about doing our part to protect and keep healthy the community and each other. For some of us, having a vaccine can be a bit scary, and we worry that it's going to be unpleasant. But I can certainly attest that our EHS team, in this case, Monica, and our pharmacists can do a really good job of making it painless. And if you're like me, you can grab another support to kind of help you through the experience. It was painless. And if you do get your shot, when you do, let me phrase it that way, when you do, don't hesitate to snap a pic and share it across to your colleagues and to the community to encourage participation. So thanks very much, Aaron. I'll turn it back over to you.
Thanks a lot, Bruce. That's great. Yeah, snap those pics, get them on social for sure. Everything we can do to make sure that people are widely aware of the the safety and importance of the flu shot, 100%. So next we're going to turn things over to Lucas Milanovic, who's going to give us an update on testing, prioritized testing for the pandemic. So Lucas, over to you.
Thanks, Aaron. Hopefully a lot of folks saw last week's notification and changing to our testing available to our employees, our staff physicians, and their family members living at the same residence, essentially at a high level in alignment with the current testing guidelines by the province. We've prioritized COVID testing for all staff physicians and their family members, specifically for those who are symptomatic and who also have symptomatic family members within the same household. But additionally now for symptomatic family members residing in the same household as an asymptomatic employee. Bit of a delineation between those 2 points in that, you no longer have to be necessarily a symptomatic patient to get the access for your family members, which is really important, I think, in the safety of our teams. Next slide. Wanting to make sure that we've got sort of a single point of contact of entry for all pathways. This still remains 42200, which is our employee health services, and will direct as appropriate. Appointments will all occur within the HHS West End Assessment Center to ensure that we've got really sort of the best location of symptomatic individuals in the safest manner. Staff physician tests are expedited. Access to appointments actually happens either same day or within 24 hours, and testing results are also resulted within 24 hours for our employees. Important to highlight that family members are 24 to 48 and do follow a bit of a different pathway, which we'll touch on. MyChart is a great way, if you are registered for MyChart already, to get results, as well as registering your family members to get more expedited results. Next slide. So if you test positive, employee health services will contact you and provide instruction and direction. As I mentioned earlier, there is a bit of a difference between the pathways for our family members in that they are directed through the public health stream, and so therefore will be contacted by public health. You will also need to contact employee health just in the event of somebody in your family becomes positive. I do want to just clarify again, I'm seeing a bit in the chat that asymptomatic staff member who has a symptomatic family member, they can book to come in the UCC for the stream, but asymptomatic testing is not occurring currently. That's in line with the current provincial guidelines. Typically, those individuals are only tested if at the direction of public health or employee health, and typically as part of contact tracing or case tracing. For more information, you can go to the hub as well as contact myself if required. Thank you.
Good stuff. Thanks a lot, Lucas, for that update. For sure, it's important sometimes go to the hub if you need to clarify on those details as your own situation evolves. So now we come to the Q&A portion of our session today. So you can raise your hand in the chat forum. That's one great way to ask a question. Another one is raise your hand in the participants forum or ask your question in the chat forum. So either will do. I'm going to open those now. Would love to hear a live question from someone willing to do that. We'll go to the chat forum. Lucas has addressed the issue of asymptomatic staff with symptomatic staff members. There is a question about the flu shot being available for family members. I know in past presentations, and I think in a note out to the organization, we did say yes, of course, family members can go to the pharmacies, but at this time, we're not promoting it broadly. Trying to reduce traffic at the sites, but it's always best to call ahead if you want to get the flu shot for a family member at a pharmacy and make sure that it is available on that day. So yes, they can take appointments from visitors, and that does include family members, correct, from Bruce there. Thanks, Bruce. Any other questions? We'll see them now in the chat forum or in our Q&A forum. Checking those. Any live questions? Would love to get one today. Any Halloween related questions, thematic, topical, things that are on your mind. Call it out. Well, maybe we can move to our celebrations portion of the agenda today. If people don't have questions, maybe they've got things that they'd like to celebrate. So using the same format today, you can certainly raise your hand in the participants box, or you can call it out in the chat forum.
Karen, so I'm attending the Nursing Excellence Awards virtual celebration this afternoon. So I would just like to give a big shout out to all of the nominees and recipients of those awards. Really grateful to all the nurses across the organization for all the work that they do. And for the folks who are being recognized this afternoon, they're kind of the best of the best. So big shout out to them.
Nice, good stuff. Any other celebrations anyone would like to call out, even from our panelists? Feel free. Here, see the suggestion around the town halls of having a calendar invite as opposed to an email reminder. We'll take a look at that for sure. Congratulations from Cheryl Booker to Ann Bauman retiring this week. Congratulations, Ann, on your retirement. From Carrie Lynn Meyer, happy National Respiratory Therapists Week, I believe week out there for all of our respiratory therapists. Thanks for that, Carrie Lynn. See here again from Kelly Turner. Yes, from Kelly Turner. Congratulations to all the Nursing Excellence nominees, especially my co-worker Alexandra Kukovic from the HELP program. Right on. Thanks, Kelly. Happy Infection Prevention and Control Week from Suzanne Anderson. Another shout out for OT month. It was last week, but worth the mention. I see. Okay, well, there you go. Congratulations to Sharon Pearson on her new role as EVP and COO. Yes, congratulations to Sharon starting November 2nd, and all of our thanks again to Dr. Stephen for his contributions. All right, the volume is slowing down. As always, I'll do one last feeble call for one brave participant to raise their hand and ask a live or give a live shout out. Not seeing any. All right, today is World Stroke Day from Kim. That's amazing, good stuff. Thanks to Kelly O'Halloran and her team for all their in-place support to congregate settings from Tammy Packer. Thanks, Tammy. Julie Matthews giving a shout out to the patient experience team because it's Patient Safety Week. It's a lot of weeks. Oh, I see Bruce with his hand up. Bruce, please.
Aaron, a shout out actually from our screeners to security staff and also our environmental assistants from across the corporation for the support that they have provided to them throughout the pandemic.
Amazing. Thank you. All right. Well, I'll turn it over to Rob to wrap things up. I do see a couple of questions in the Q&A forum that we didn't get to before we transitioned to celebrations, but rest assured we'll get you an answer on the hub or directly if we have your email. So those questions won't go unanswered. Thanks for raising all of those, and thanks everyone for your congrats and shout outs today. Rob, why don't you close this out?
Yeah, thanks, Aaron. So I know it was kind of a briefer session today, and I just reiterate Aaron's point. If your question didn't get answered, please go on the hub, or of course, we will be having another town hall in November. So thanks all for attending. Thanks everybody for continuing to work so hard to make HHS a great hospital, and hope everybody has a great rest of the week. Please stay safe, and I know everybody is likely already doing this, but you know, each and every one of us working at HHS is a kind of opinion leader in our respective circles, and so really encourage people to be getting the message out about washing your hands, about social distancing, about wearing a mask. I think, you know, we can make a big difference in our respective circles and in our communities. So really encourage people to speak up and make sure that, you know, if somebody's saying something that doesn't accord with good science, and that seems to be happening a lot, say something. So cheers, everybody. Have a great rest of the week.